Hello, welcome everybody. Welcome to every other Tuesday night, Your Health Matters OC. This is Dr. Clayton Chow. With me is Dr. Regina Chinzio Kwan, otherwise known as Dr. CK. We are co-hosts for this show, and welcome to the topic of this evening is going to be on sexual transmitted disease and any other question related to sexual health. So if you do have a question, please go ahead and send us an email as yourhealthmatters@ochca.com. Again, the email address is yourhealthmatters@ochca.com. So let's start with Dr. CK before I introduce to our two expert guests tonight on this topic. CK, can you give us an update on where we are with COVID?
Yes, thank you. So our case rates have gone up a little bit. We're at 4.6 per 100,000, whereas previously we were below 4 last week. And our 7-day case average is at 153. Our case positivity also has increased to 2.4%, where it was previously 1.9%. So we're seeing an increase. We do know that this is likely an underestimate because this is reflective of only the cases that we have by PCR. And we know that many in the community are testing via antigen or home test, which are not reported to us. That being said, the good news is our hospitalizations remain low, with 60 in our hospitals with COVID and 10 in our ICUs with COVID. And hopefully we can get to single digits for the ICUs. But again, the hospitalizations are a lagging indicator of the cases in the community. So even though our cases may be low, I think everybody in the community should still, take all the precautions. You see all of us still masked up here because we do believe that the masks do protect us. It gives us an extra layer of protection. And we know that many can have no symptoms at all and still carry COVID. And there are many people here who have high-risk individuals at home where we're trying to protect our loved ones. And again, in our hospitals, 86% of those experiencing hospitalization with COVID are unvaccinated. So we do know that people are still having severe illness. And we want the community to know that if you do find yourself with a positive COVID result or you have symptoms, please alert your provider, your healthcare provider, because there's many different COVID treatments that are now available and you may actually be eligible. For our vaccination stats, we have over 2 million individuals in our county who are now fully vaccinated, and over 1 million, so 1,256,257 who've received a booster or an additional dose. And just as a reminder to all the viewers, there has been some adjustments with boosters. FDA has now authorized for a second booster for certain individuals who are higher risk. So those of you who are viewing this and are above 50, you can actually get your second booster as long as it's been 4 months since your last booster. And if you're under the age of 50, between the age of 18 and 49, you can actually get your second booster if you're immunocompromised. So if you have questions about that, please ask your provider. If you actually are under the age of 50 and you received Johnson & Johnson as your first dose as well as your booster dose, you also are eligible for a second booster, preferably with an mRNA vaccine.
And that's any age?
Yes. So usually that's 18 and above.
Right.
Yes.
Okay.
So for our 5 to 11-year-olds, we now have 32.6% who are fully vaccinated. And for our 12 to 17-year-olds, 67.1% fully vaccinated. And for 65 and up, 92.6% are now fully vaccinated. And again, I encourage your parents who are still, having questions about these vaccines to really talk to their healthcare provider or their pediatrician to get their questions answered, because it's really important. We know that now there's a lot of people enjoying the summer weather and out and about without masks in public spaces. And this is where, yes, it's fun, but there's also the risk of continue to be exposed by COVID, and we really want to make sure you and your family are protected. That's all I have.
So the key takeaway is that even though we have seen a small increase in cases across the country, including California, but don't rely on that number because, as Dr. CK mentioned earlier, those are the number that been reported to the laboratory based on the PCR testing, right? As you are aware, many people are doing home antigen testing, and those tests don't get reports. And for those of you who have been curious about all this laboratory testing, we got an expert here tonight to talk to you about that. So we will address that issue. So that's number one. There is a change in the mandate for masks in the transportation hub, buses, airplane, train, etc. So Dr. CK, you want to remind us, because that just came out yesterday, yeah?
Yes. So all the guidance and the requirements for a mask in public transportation hubs, as well as airplanes and trains, go under the federal jurisdiction, the federal guidance. And as of yesterday, there was a ruling that took away the requirement for masking. And so right now, I think there's still a lot of people waiting to hear from the CDC about that. Now, from our standpoint as physicians and from public health, we still strongly recommend that you wear a mask, especially in public spaces and especially if you're at higher risk.
Or live with somebody who's high risk,
right,
yes.
or you're visiting someone who's higher risk. Because it's in these closed spaces, in these public areas with poor ventilation, where you're breathing recirculated air, that you can actually get exposed or transmit COVID. And so that's the highest risk area. So again, we still strongly recommend that you wear a mask. But we do understand that, being in the air, being in a public transportation really falls under the federal guidance.
Yeah, but to remind folks, if in case you don't know, I think last week, several airplanes that have hubs in European countries reported that since they downgraded their in the airplane mandate for everybody to wear masks, what has happened is they have had to cancel hundreds of flights, and the reason being their staff, the flight attendants, many of them got sick, so they had to cancel. So we do know that wearing a mask in the airplane actually provide strong protections, not only for the passenger, but also for the server, for our flight attendant. So unfortunately, that is what happened with our federal regulation because a judge ruling, and so that might change. But again, strong recommendation: if you are at risk, if you are visiting somebody at risk, or you live with somebody at risk, assess your own risk and take the appropriate measures to protect yourself and your loved one.
Right. And again,
makes sense, right?
Vaccinations are the best way that you can protect yourself against the severe impacts of COVID. And we know that we have not learned as much about COVID yet, and we still have much to learn, especially about long COVID and the long-term consequences, which I'm most fearful about as a primary care physician and as a mom. So really take the protection, layer up with protections, especially when you're in the indoor setting.
Right. So if you are sick with symptoms, get tested, contact with your family physician or primary care physician. If you are exposed, we recommend that you also get tested as well, right?
Correct.
And so you know and take the proper precautions. That's the best thing that you could do to protect yourself. Although we have treatment now are widely available, there's programs such as Test to Treat that you can get at some of the pharmacies that runs minute clinics, and you can get a list of those pharmacies in Orange County on our website at ochealthinfo.com. We have a directory of where those places where you can go get tested, and if you test positive, and there are treatment for it. Yes, we have treatments, but we don't know what the long-term side effects of the treatment would be. But nevertheless, they really do prevent people from getting more severe or hospitalized. Right. However, and I still hold to that today, is that the best way to get out of this pandemic completely, truly, is that everyone who eligible for the vaccine, please get vaccinated. That's the only way to really get out of this pandemic. So before I introduce our guest today for the topic of sexual transmitted disease and sexual health. Well, let me go ahead and introduce them and ask them to say hello and tell the public what you do in terms of your role here at Health Agency. With us, we have Dr. Megan Crumpler. Megan, please say hello.
Sure. Hello, everyone. I'm Megan Crumpler. I'm the Laboratory Director for the Public Health Lab here in Orange County.
Okay. Next to Dr. Crumpler is Dr. Jeffrey Vu.
Thank you so much for having me. My name is Dr. Jeffrey Vu. I'm a nurse practitioner and a nurse, but I am the Director for Clinical Services here at Orange County Public Health.
And so let me ask Dr. CK this question from Dawn, who sent us an email and asked, "Hi, I'd like to know that I had COVID and I had recovered it since a month ago. I want to know if it is safe to have sex with my spouse after I recovered from COVID. How long should I wait to do sex after recovery? I tested it and it is negative now," meaning he's negative now, "and I have no symptoms of any cough, fevers, anything."
Yes, so the good news is this patient actually, or this resident, already tested negative, and so likely can already resume intercourse, especially if their viral load on the test is proving that they are negative and have low viral counts. Now, depending on the situation, if you're of regular risk, you're not immunocompromised. Typically, if you just follow the isolation recommendations, which is basically isolate for at least for 10 days, or you can test out after 5 days. If your test is negative at 5 days, you can resume your regular activities, but we do still recommend that you wear a mask to protect others. So if you really want to be careful, maybe you want to wait that full 10 to 14 days before you go back into any activity, sharing saliva or different juice things, and that's
Normal sex.
normal sex, yes.
Normal activity.
Normal activities, you can resume that again
Absolutely.
once your test is negative and your symptoms are resolving.
Perfect. So let's talk about sexual transmitted disease. We understand that since the lockdown, there have been an increase in certain sexual transmitted disease, right? So, Dr. Vu, do you want to talk about the statistic?
Yeah, actually one of the specific statistics is gonorrhea in the U.S. and here in Orange County has increased over the last 3 years, and we're still waiting for our 2021 data to come in, but our 2020 data has shown that there's been an increase over the last 3 years. And in particular with gonorrhea, there's symptoms, oftentimes with burning with urination or discharge. So that often will bring people in to get seen. You can get seen by your primary care provider. You can come to one of those urgent cares or specific locations in pharmacies. But we even have a location through Orange County at our 17th Street Clinic, and we can talk more about that at any point.
What about syphilis?
So syphilis has actually been on the rise, and that one also doesn't have very many symptoms, and so it's hard to catch sometimes, and sometimes when the symptoms do present, people kind of brush them off, and so they can progress further and further along. So that one, it's hard to catch unless we're testing on a regular basis. So that one has been on the rise, yes, here in Orange County, but one of the most concerning issues is that congenital syphilis, with babies being born with the exposure to syphilis in utero and as they're being born. Unfortunately, it can cause death.
From the mother. Right.
From the mother, yes.
Be very specific.
Yes.
Dr. Vu. So, Dr. Crumpler, you mentioned before the show the really astounding statistic on the rise in syphilis. Do you want to share with us?
Sure. Last week for STD Awareness Week, the CDC released their STD surveillance report for 2020, and they, in that data, they showed that there was a over 250% increase in congenital syphilis cases in the U.S. since 2016. So it's a nationwide issue. We're seeing very similar statistics, Orange County trends with the national trends of, a slight decrease in chlamydia, but increases in both gonorrhea and syphilis.
But do you think that the decrease in chlamydia is because of the lockdown? People don't go and get tested. People don't routinely go get tested.
There's some, CDC suggests in that report that there's a lot of different factors that impacted STD testing during the pandemic, with clinic closures, redirection of public health staff from their STD clinics to COVID. Maybe people weren't going in to get tested for things like chlamydia because they're typically asymptomatic, and so we saw increases in the others because they would have symptoms, and so they'd be more likely to see their healthcare provider. So I think there's a lot of confounding factors that occurred during the pandemic, and I think we still have years and years to see what the impact of COVID was on STD and in our populations.
So as a primary care physician, what do you advise young parents, who especially those who are pregnant and get ready to deliver, on the congenital syphilis? What is the consequences, et cetera? What do you say to patients?
Well, typically when a couple is thinking of having a baby, we want to pre-screen for all the sexually transmitted infections. We want to make sure that neither of them are carrying any infection that can easily be treated. And then once we've cleared them with that, then we start with talking about having a family. Now, if someone comes in already pregnant, we still actually do the screen. We look for HIV, we look for gonorrhea and chlamydia. It's a simple swab. We also look for syphilis because we're worried that if someone is pregnant and has syphilis, all these infections are easily treated during pregnancy and we can divert the mother from transmitting it to the baby. So just want to make sure people out there really screen because there's so many treatments that are available that can really prevent you from getting the long-term consequence. Like congenital syphilis is something we all worry about because it's something that's easily preventable. And when an infant actually is born with congenital syphilis, they have a high likelihood of passing away. They have low birth weights. They have issues with development. They have bone abnormalities. They have blood abnormalities. Their liver and spleen get enlarged. And sometimes some of those symptoms or signs actually are delayed. They can be delayed even into like early childhood, depending on when the mother actually was infected with syphilis during the pregnancy. And again, this is all preventable. And once the baby is infected, it's hard to reverse all the effects of congenital syphilis.
Yeah. But if you don't detect it and you don't treat some severe cases where young infant could develop glaucoma, cataract.
Right. So there's many different eye issues that actually happen. It can be the front of the eye, it could be inside the eye, and even the retina. So there's multiple parts of the eye that can be affected. Also, the lungs can be affected, so they can have pneumonias, but they also have significant bone deformities. And if they don't have the deformities, there's just growth deformities or there's a lot of bone pain. One of the classic things we learned in med school is that if it was an untreated or undetected syphilis, sometimes kids, when they get older, they're just delayed a little bit, and then their teeth will have this abnormality, like a jagged edge to it, a very specific look, or their nose may look a little bit different, or their forehead may be more protuberant.
So Megan, talk about testing. What kind of options of testing for people?
So we have a lot of options for testing in our community. 17th Street Clinic is an option. You should talk to your provider about sex and about getting tested for STDs. We also have a mail-in option that's available called takemehome.org, where in the privacy of your own home, you can actually receive a kit to test for yourself in your home, for HIV. And then you can send specimens to a laboratory for testing for the other STIs.
So is that easy? I can go online and get the test.
You can go right online. I actually tested it out yesterday after I got the link, and you put in some information. The testing is all free, and you just put in a little bit of information to see if you qualify, and they'll send it right to your house.
So early on, I talked about this process of testing for COVID. Let me, go on a tangent a little bit and ask you to address the option for testing for COVID. now that we're in year 3 of the pandemic?
Sure. So you did mention some of the options, but really what's emerging as one of the main testing options for people are tests at home. Those are now becoming more widely available as companies are able to produce them more. So those are maybe the tests that you ordered from the covidtest.gov website, or you can pick them up at pharmacies. So that's where you would actually you have your test kit at home. You swab your nose, your throat, and you have your little cartridge. About 15 minutes, you get a result. There's other options for self-testing at home where you can get a PCR test done in a laboratory. So a lab, you'll be able to pick up a collection kit. They're available at our pods where you can get vaccines through the county resources. So you can pick up your test kit there, swab yourself. You send that to a lab for PCR. You can access antigen rapid testing or PCR through providers. So, you can go to your healthcare facility. Those options are pretty widely available now. And of course, the pharmacies have, you could go there to order your PCR or antigen test on site. So we have a lot of options.
That's great. It's important. I think we inform the public about this, is that if you have private insurance, not yet on Medi-Cal and Medicare, but if you have private insurance, you are entitled to up to 8 antigen tests a month for free. So you can go up into a pharmacy and get that through your insurance. And then if you need more than 8 tests, your primary care physician can actually write a prescription for you to get more, with reason, of course. But something happened last week that I thought is very exciting, and that is new technology. The FDA just authorized a breathalyzer to detect COVID-19. Are you comfortable talking about it, Megan?
Well, I just read the FDA press release last week, so I'm not really familiar with a lot of the technology. But what I did read was it's a quick test. It's a breathalyzer like you would do for an alcohol breath test. It's a little low volume, and the company is working on producing more of the actual instrument, the machine. But they claim that they can do about 100. One instrument could do about 160 tests a day. So this is the first time that we've had something like this for an infectious disease test. I mean, it's really remarkable. And so the technology is there, and so now we'll see how it kind of progresses. But I think there is a lot of interest around this because of the contagiousness of COVID and it being circulating in the air. And so there's a lot of focus on ventilation and air quality. And so just having this other component of testing, from the air, I think putting all those together can really put us in a good place for the future.
Well, I know we have saliva testing, PCR saliva testing, but this really offers another convenience for especially youngsters.
Especially for kids. It's
I'm
hard
so
to swab
excited
kids.
about that, right?
My daughter absolutely hates that
The swab.
swab up her nose. Holy cow.
We don't know how much it costs yet, right?
No, yeah, there's no information.
At least we know the technology is there, so this is very exciting.
Yeah.
Hi, everyone. If you just tuned in, you are watching Your Health Matters OC. This is Clayton Chow and my co-host, CK. Welcome. The topic tonight is on sexually transmitted disease and sexual health. With us, 2 experts in this area, Jeffrey Vu and Megan Crumpler. If you have any question while you're watching, send us an email to yourhealthmatters@ochca.com. Again, yourhealthmatters@ochca.com. Jeffrey, what services do we offer in the 17th Street Public Health Clinic? We said 17th Street is 17th Street in Santa Ana.
That is right.
Very close to Bristol.
Yes, so on the corner nearby Bristol and 17th Street, the address is 1725 17th Street in Santa Ana, and we offer free services for STD, HIV, for those who are already diagnosed with HIV. But if you're just looking to get tested and treated, we have options for that. We also have PrEP for those people who are interested in PrEP. It's pre-exposure prophylaxis or prevention to prevent HIV. It's as simple as taking a medication every day. Just like a vitamin, I guess. And we have that as an option. And for those individuals who have had exposure, we also offer PEP, post-exposure prophylaxis or prevention. So some people don't realize where they can find those services, and we have those at our clinic, we call it our testing and treatment center. So if you're looking for the TTC clinic, that's where we'll be.
So, what would be the number for people to call in to get services?
Yeah, so the number is actually going to be listed online, but it's you can find our website at the ochealthinfo.com/STD, and that'll get you to the correct page for us. But if you ever needed to call us, and you need to get directed either to services for STDs, HIV, PrEP, or PEP, all those things I was talking about, you can call the 714-834-8787 number. Again, that's 714-834-8787, and we can get you over to the right location. And actually, in the same building, we have our family health clinic, which does offer opportunities to talk about like pregnancy prevention and some of those options. We offer through our FPAC program for both males and females. We can offer condoms and birth control options. So even another opportunity to talk about things that can happen during sex, right?
Right. Hey, CK, there's a question from Ronald. I think this is a great question. I've not been asked about this, but here's the question from Ronald. Do you think COVID has any long-term effects on sexual health?
I actually do think it probably has long-term effects. But I don't have this substantiated with any science, but just if we think about COVID already causes significant inflammation throughout the body in many different organs, and I wouldn't be surprised if there was an effect on the reproductive system. Already, even before COVID, we've already seen, as a primary care provider, I've seen a lot of, there's a significant rise in infertility. And actually, with a lot of these sexually transmitted infections that we're talking about, chlamydia and gonorrhea specifically, those definitely can really increase a female's risk of having infertility because it causes inflammation along the fallopian tube, which is the tube that connects the ovary where the egg comes from and allows the egg to go through this tube and into the uterus. So if that tube is inflamed, then it's hard for an egg to even meet the sperm to fertilize and start a baby. And that usually is the reason why it's so important to screen for gonorrhea and chlamydia and get that treated immediately instead of waiting. That being said, if there's inflammation in many parts of our body and vessels, that likely also involves the reproductive system.
Yeah. So it's interesting point that you just raised, right? There's so much misinformation and disinformation on how the vaccine affects fertility, but in fact that is not true. It is actually the other way around. COVID infection actually affect fertility because of this generalized inflammation, right? Yeah. That you just explained. It makes total sense, okay? But more than that, we do know that a quarter of people who, after they had COVID, without predisposed, without precondition, without any mental health issue prior to the infection, about a quarter of them develop anxiety and depression. That's the fact. And so I can infer and said, that is probably sexual health, your sexual health will be affected because we do know that depression and anxiety really changes the sexual desire, etc. So in roundabout way, I think that that's one way that we can infer and answer Ronald's question, and that is definitely there is some effect on sexual health for people post-COVID, especially people who develop long COVID symptoms, right, such as depression and anxiety.
And I think you brought up last time that already in pregnancy, we're already seeing the effects of COVID in that, some of these births the placenta is already infected. There's a lot of scarring on the placenta, and that's the main organ that helps deliver and transfer blood to the baby from the mother. And that some of these babies are born at lower weights. So it obviously does affect also a pregnancy again. So if you're listening, you're pregnant and you have COVID, please get treated, or please seek care and just get vaccinated, please, please, please.
So let's go back to talking about sexual transmitted disease. There is a federal nationwide effort since 2019 to end the HIV endemic. Okay? Dr. Vu, what are we doing in Orange County?
Yeah, so Orange County and our neighboring counties have actually been granted a large amount of funding. HIV has been around for several decades now, and this has been an opportunity to actually implement some novel ideas here in Orange County. So we're working through that at this point. The pandemic kind of put a little bit of a wrench into things, and it gave us an opportunity to work through that, but we're working with our community partners and trying to identify our high-risk populations, trying to ensure that we are preventing HIV through things such as PrEP, that pre-exposure prevention medication, and just making sure that we are trying to decrease or actually end any more contracted HIV diagnoses in the coming near future.
Yeah. So Megan, you spoke earlier about testing and how easy it is, and I thought I heard you mention testing for HIV. Do you want to repeat that specifically and what we do in the 17th Street Clinic and our public health lab could offer?
Sure. At the public health lab, we do testing for our clients both in correctional health and also our 17th Street clinics. So it's a blood draw from the patient, and then the specimen comes over to the public health lab where we do HIV screening on that to look for reactive specimens. The other option was the takemehome.org, which is there's only one FDA-approved HIV at-home test that is available. And so that's one that can be performed at home. But our test is a laboratory-based test, and we run an algorithm for testing that's recommended by the CDC.
Okay, so here's a question for the two of you.
All right.
Whether you could, or
Let's see.
CK too. So this question is from Chris. Hi, I just started a new relationship and got tested for HIV and others just to be safe. If I keep seeing the same person, do I need to get tested again later, or is one time enough? That's a very important question. Who wants to start?
I guess I'll start. I think that's, you're doing the right things to start off with, Chris. You are making sure you are getting tested, and, always the only way to know is to get tested regularly. So as frequent as every 3 months, but at least on an annual basis. I'm sure you're doing your annual physical, or you should be. So this is a great opportunity to have that conversation with your provider, and then making sure that you get that test added on an annual basis, and it's part of your annual lab. So it shouldn't be any difference with you. So at least on a once-a-year basis, and I think also a lot of that's going to be a conversation between you and your partner. Right? Because what your risks are based on the relationship that you have and the trust that you build with each other. So I think that both of those places, how to start a conversation with your partner and how to start a conversation with your provider are good places to start.
Talk about the partner testing program that we have. Either one of you? So
when a patient does test positive, if someone does test positive, then in the state of California, we actually, your provider who orders the test or is prescribing you the medication for treatment is able to treat your partner too. It's called expedited partner treatment. There's a lot of ways to go about it, but there is, that conversation that does need to happen. So when a patient does come in to get tested, or if they test positive, being honest with the partners they have had, so we understand what risks there are and who to contact to do the expedited partner treatment. Mm-hmm. But that, we'll go back to the primary care provider. CK, do you want to
Yes. So usually whenever I see a patient who has a positive test, usually the conversation next is who is your recent partner? Who are your partners? Because you need to alert your partners and notify them so that we can either prescribe for them or they can also seek treatment from their provider. So that's really important because we also have a responsibility to make sure everybody's safe. But that being said, I do agree that regular testing, regular screening is important. In my military days when I took care of many different families, while we always want and hope that couples are mutually only seeing each other, unfortunately there are times where people have relationships with others, and so then that's where a test may end up positive for chlamydia, gonorrhea, any of the STDs. And again, aside from how this person got, the main importance is how do we get treated so that we don't continue to infect others. So unfortunately, it does happen. I've seen it many times, and it's a hard call when I have to call a patient to say, your test is positive for chlamydia, let's get treated. And usually there's a lot of emotions that are high during that call or during that visit because the person feels like they were, lied to, or someone, there was mistrust also in the relationship. But again, a lot of the infections we were talking about are treatable if they are actually tested. But there are other viruses and infections that it's not easily treated, right? Sometimes, like example, herpes. If you get herpes, while we do have treatments, unfortunately, it's lifelong that you are going to potentially have recurrent infection, and you just have to kind of live with that. And there's other infections that really go unnoticed until we actually do a screening. So HPV is the example, human papillomavirus virus. And human papillomavirus virus, usually we see it when we have an abnormal pap smear for females, or when people have, wart. It doesn't go away, or maybe later down the line they actually have cancer of either the rectal area, the vocal cords, the oral pharynx, or the cervix, which is in the female organs. And that's unfortunate because it could be preventable. And when we talk about sexually transmitted infections, I want people to be clear that there are so many ways that you can transmit it. It doesn't have to be the usual typical idea of sex that we think about between partners. It can also be oral intercourse. It's just, again, transmission of fluids that can happen. So I've seen gonorrhea of the eye where it's a really thick discharge, but many times people have no symptoms at all, and we catch it on screening. And gonorrhea and chlamydia are now easily screened out with a urine test. And again, easily treated, and I really want to make sure everybody on the call here who's listening knows that they can be screened and tested and treated. And if you're doing your routine physical, talk to your provider and ask them about other screening. So there's also the hepatitis viruses, HIV, which is not always routinely done, but it should be offered because we do have treatment. Gonorrhea and chlamydia are more common, and I'm a mother, and I know that it's a hard conversation with parents.
We'll get there. Hold on.
Okay, I'll hold on.
Yeah. I think the important thing is the reason why we call them sexually transmitted disease is actually the only way to get it is through sexual intercourse, vaginal intercourse, anal intercourse, etc. Right? So you can't get it from casual touching. That's the important piece, right? Because I've heard people who freaked out. Oh, can I get it by touching somebody's chairs or somebody's clothes or share a table? No, you don't get it that way. Oral sex, anal sex, vaginal sex, right? Mm-hmm. So because it's the transmissions of the fluid. Okay, mm-hmm. So the ending of the HIV epidemics talk about diagnosis, mm-hmm. talk about responding to outbreaks, talk about prevention, and talk about treatment. So we plenty of conversation around diagnosis and responding to outbreak. I mean that's why the public health lab is here. So we quickly responding to outbreak, and then treatment. The prevention piece. Now we're going to get into hard conversation. So from the prevention perspective, what does the 17th Street Clinic offer, Jeffrey?
Yeah, so part of it is testing on a regular basis, but in regards to the ending the HIV epidemic, there's this pre-exposure prophylaxis PrEP medication that's available. You do have to see a provider every 3 months, and so that's why coming in and getting tied to us here at the at RTTC clinic at 17th Street. Also, I think there's there's many options to find PrEP providers online, and you can see a map and see who's close by to you, or even as simple as asking your primary care provider. And it does require regular testing, so it does include your full gamut of STD testing every 3 months usually. And then you'll get your treatment for your medication, and you take it on a regular basis, and it's more than 90% effective for preventing the contracting of HIV. So not to say that you couldn't get other STDs, and that's why we do testing on a regular basis every 3 months. And what you can do in addition is to use condoms. Condoms are a great barrier method as far as preventing many other STDs in general. But for oral sex, there's such things as dental dams, excuse me. And there are new and up and coming protective measures that are just recently getting FDA approved. So,
But do we at the 17th Street Clinic give out free condom?
yeah, come on by. We do have them available, but also just down the hallway we have our family health clinic where people can be coming in to talk about contraceptive methods, and through our FPAC program, male or female, you are qualified to get condoms. But I believe you can get a prescription from your primary care provider and bring that to the pharmacy also to get condoms.
So there's a question from Ronald. Are there lubricants that break down condoms? What condoms are the best to use to protect both from disease as well as prevent pregnancy?
So any condom that you can find commercially would be is acceptable, right? And as long as it's maintained, it's not in heat. Make sure you don't keep it in your wallet or keep it in your car. Keep it protected in its own way. Protect your protection, I guess. And so then that way it doesn't start to break down itself. But whatever you and your partner works best for you are going to be best. So some people, the most common one you'll find is latex condoms, and those work for most people. However, some people are allergic to them. So there's a couple other options for people. And to answer the question about lubricants, most lubricants that are out there are going to be water-based. So if you have something like KY is a common name brand. It is water-based. You can add water to make it more lubricant. And then otherwise they're silicone-based. What you have to be thoughtful about is for those individuals who use toys, plastics can get broken down by the silicone. So water-based works better for those ones.
So this is a question from Anne Marie. Does the healthcare agency provide access to women's health?
Yeah, so that's actually a great segue to our family health clinic. That is what our FPAC program is really centered around. So having the conversation. We do see children also, but for those women in particular who are looking for to talk about contraceptive methods, that is an option. For perinatal care, we don't offer it at our clinics. However, if you are pregnant, there are opportunities. You can come to the 17th Street Clinic, and we can help make sure that you're tied into services. So don't ever feel like if you have a question, we can make sure that you get your questions answered before you go.
Yeah. And Anna Marie, thank you for these questions. It's very important for general public knowledge, and that is there are over 20-some community health clinic in Orange County.
Yes.
And you can go on to the Orange County Coalition of Community Clinic to look at the address of the clinic that's closest to you. And they provide free to low-cost care for individuals who don't have insurance. So absolutely, please seek out health care. Now, Anna Marie asked this question. It made me think that Anne Marie might be a youngster. What do I do if I come across someone that refuses to sell me contraception or birth control? I've not heard of that.
Oh, I've heard of
CK?
it. Yeah. So then seek guidance from another provider. So there's many providers out there who are willing to prescribe contraceptive, and you can also go to a pharmacy if you need the day after pill, right? So there's many different avenues. Again, if your provider's not meeting your needs, seek care from another provider. That's easy.
Yeah, we always say you're always welcome to a second opinion, right?
Yes.
But we can always see you over at our 17th Street clinic. Please, that is another option, and that is free to you. So if you can't get what you're looking for, at least to have the conversation, you can come on over to the 17th Street clinic.
And this makes me think Anne-Marie is a teen, because Anne-Marie asked, does Health Agency provide guidance to schools regarding teen health care and teen sexual health awareness? I know that the school district and OCDE do have sexual health program. And so Anne-Marie, I would strongly recommend that you talk to your school nurse for those classes. They should be widely available. So don't be ashamed to talk about sex, right? These are such part of us as human, especially for young teenager. You need to talk to an adult that who you can view as a confidant, right? Could be your primary care physician, your pediatrician, or your school nurse. But how do you talk to your kids about sex, for those of you who have kids in this panel? So let's start with you, CK.
Well, I kind of used all the medical terms. Yes, I'm a doctor, and I know my son is like, I don't want to hear it from you, but I just talk about it I just talk in scientific terms. Maybe I just say, hey, the birds and the bees, right? Female, male, or male, male, female, female, we can come together. But how is a baby made? Egg and sperm have to meet, right? That's how a baby is made. But that being said, the other thing I wanted to mention, because it's sounding like this is a teen that's also seeking for services, just want to make sure all of our viewers know also, if you're a teenager, 12 and up, you can actually seek services on your own, especially as it pertains to sexual health or mental health. So again, I know that, I even tell my son, look, I know I don't want to hear as a parent that one day you're going to be sexually active, but I want you to make sure that you know that there are resources for you. If you don't feel comfortable with me, there are resources for you. And that remains between you and your provider. It's private between you and your provider, because we want those individuals to get treated. But yeah, I told my son that a baby is made by a sperm and an egg, and he is of age where, if his sperm meets another egg, that can create a baby. So.
Very good.
We're not quite there yet, but what I am working on, my kids aren't quite that age yet, but what I am working on is just keeping the lines of communication open, so when the day comes and we need to have that talk, that they'll be ready to listen and talk to me about it.
Very good. So I guess I think that is very important to normalize what sex is and what sex isn't, right? The most important conversation is about the human respect within youngster. Mm-hmm. I think that's an opportunity to talk about gender biases and the respect between boys and a girl, or men and a woman. I think that's an opportunity to talk about that, right? Mm-hmm. I know teenager is struggling with that. And they feel embarrassed, or they feel shameful, and they don't want to share. But yet there's tons of questions. Yes, there are school program that talk about sexual health, but I think conversation with the parents or with their trusted adult confidant, like a school nurse or a pediatrician, is very, very important. Mm-hmm. And hopefully their pediatrician spend time to talk to them about it, right? There's no such thing as stupid question for the youngster out there watching. There's no such thing. Okay, if you're curious, please find the right answer, right? Mm-hmm. Don't go online and search for misinformation. Mm-hmm. Talk to your trusted adult. So that's most important. And so when we talk about COVID, back to COVID, and the effect of COVID on sexual health, there's a question from anonymous person, and I thought this question is very interesting. Let me read it off to you. Oh, good Lord, I think I lost the question. Give me 1 second. This has to do with whether or not orgasm, let me see, here we go. Is orgasm always the end result of a sexual encounter? What if I can't or don't have orgasm every time? How do I explain that I enjoyed it still to my partner? First thing first, communication. This is very important. I think communication with your sexual partner from issue to no issue is really, really important. You know, what you prefer, what you enjoy communicating with your partner every step of the way always bring better sexual relationship or a marriage or a relationship for that matter. But there are people who don't achieve orgasm every single encounter, right? And there are people who don't ever have orgasm, so that could be a condition that you want to discuss with your primary care physician. Or for women, you know, you can talk to your gynecologist about it. For men, you can talk to your primary care physician or urologist about it, right? So there's always professional help, right? There's no such thing as what is an normal or abnormal orgasm. Everybody is very, very different from achieving orgasm to a sexual desire. But definitely, if you don't have any of that, talk to your primary care physician. CK?
I agree. Talk to a provider who can walk you through, because there can be some other things going on. There's maybe some other relationship issues, or maybe some history that you have that is preventing you from doing so, or it may be anatomical, but you won't be able to find that out until you talk to a specialist or a professional who knows how to talk to you about that. And depending on the sex and depending on the reason, there may actually be some medications that can be tried also. And sometimes medications cause the issue and prevent you from having orgasm. So it's actually more complex, and it does require a good discussion with your provider.
Yeah, but one of the common things that we do know that actually does affect people's sexual health, and that is drugs, illicit drugs, and alcohol. Right? So you need to look for common causes, and those are the two things that we know really do affect people's sexual health. So we're in the last minute now. Any advice to start with, Megan? Testing.
Advice around testing. Don't be afraid to get tested. STD tests are generally pretty non-invasive, a simple swab or a urine sample or maybe a blood draw. But, talk to your provider, go get tested. Look at some of the at-home options if you're concerned or nervous to go to your provider. And then, but you may want assistance in interpreting the test result after if you're confused about that. So,
okay. Jeffrey?
Yeah, and I would say that there's a lot of stigma around STDs and talking about sex in general, and I think that just getting tested regularly is the big key, right? As often as even every 3 months, or even more frequently if you think that that's something you need. But there are options out there, and many of people who are willing to help to answer your questions and to get you treatment or prevention. Like, again, I'm going to say it one more time, but that PrEP, pre-exposure prophylaxis treatment, people don't realize that there are medications out there that can help prevent disease, the spread of disease, and if you are infected, that we can treat you actually pretty easily, and to hopefully bring down that stigma, that we can move forward as one big happy world.
Yep. And for our teenager out there, there's no such thing as dumb question or stupid question, as you say it, right? Talk to your parents, talk to your adult confidants, again, your pediatricians or your school nurses, and then talk to each other. right? The communication is the key. So thank you so much for watching Your Health Matters OC. Thank you to our special guests who are here today to talk to us about the topic of sexual health and sexually transmitted disease. So our next talk show host is Tuesday, May 3rd. Oh my goodness, April is ending so quick. So on May 3rd, May is the National Nursing Month. So we will have our special guest who's a Chief Nursing Officer for Orange County here to talk about various topics related to nursing, ranging from, well, what is a nurse practitioner? What kind of treatment can a nurse practitioner provide? What's the difference between a registered nurse to a BSN nurse to a master level nurse to a public health nurse? So she's here to explain all of that. And then we hopefully will get into information with her, conversation with her about a career in nursing. So I'm very excited. Thank you to our guest tonight, and see you on May 3rd. And between now and then, if you have any question, again, send us an email at yourhealthmatters@ochca.com. Again, yourhealthmatters@ochca.com. Thank you so much. Good night.